Hello everyone! This is a short informational video about breast cancer, but before we get into what breast cancer actually is, we have to figure out what is cancer. So, cancer is the development of abnormal cells that divide and have the ability to destroy normal body tissue. When most cells have something wrong with them, like a mutation for example, they will recognize this and go through apoptosis. So, apoptosis is the process of a cell destroying themselves if they have something wrong with them. But some cells do not go through apoptosis and will begin to spread. So, sometimes a cell will have multiple mutations, or a mutation won't let them go through apoptosis and they're able to spread, and that is how cancer cells are able to spread. On this little diagram over on the right, you see on the left side we have pictures of normal cells under a microscope. And on the right side, we have pictures of abnormal cells or cancerous cells under a microscope. And you can see how they're kind of distorted. You can't see the nucleus as well. There's not really a defined shape to them. They just all around seem like there's something wrong with them. But on the left side, you can tell that there's nothing wrong with the cells and that they're perfectly fine. What is breast cancer? So, breast cancer is abnormal cells in the breast that grow and divide and may cause a tumor. A tumor is, according to Merriam Webster Dictionary, an abnormal, benign, or malignant new growth of tissue that possesses no physiological function and arises from uncontrolled, usually rapid cellular proliferation. So, back to what I had just said about cancer cells spreading, that is what will happen. And sometimes a tumor can be formed from those cells building up on each other. Some cancerous tumors in the breast may be benign, which cause no harmful effect. So sometimes tumors will just be created and they will just sit there in the skin. They won't bother the body or the person, they'll just kind of be there. While others may be malignant, which is infectious and can be harmful. Malignant tumors will do harm to the person and or the body, and they have the potential to spread to other parts of the body. Anyone can get breast cancer, although it is more common amongst women. Male breast cancer makes up about 1% of all breast cancer cases and primarily affects older men. So, yes, everyone can get affected by breast cancer. It is just more common in women. What are the signs and symptoms of breast cancer? Signs of breast cancer may be found during breast screening exams or may be noticeable on the body. Some major symptoms include, but are not limited to, a lump or thickness in or near the breast or under the arm or in the armpit, unexplained swelling or shrinkage of the breast, particularly on one side only, dimpling or puckering of the breast, nipple discharge or fluid other than breast milk that occurs without squeezing the nipple, breast skin changes such as redness, flaking, thickening, or pitting that looks like a skin of an orange, or a nipple that becomes sunken or inverted, red, thick, or scaly. And here we have a small diagram, and you can tell all the different types of signs or symptoms. Over here we have texture change, some dimpling on the side of the breast, lymph discharge and blood discharge over here. Over here we have redness or rash on the breast and kind of near the armpit. We have here a lump in the armpit, which is also another sign of breast cancer. Nipple inversion, so that's the nipple going inwards towards the breast, and a lump on the breast. As you get older, you are at a higher risk of developing breast cancer. About 80% of breast cancers are found in women over the age of 50. You are 2 to 3 times more likely to develop breast cancer if you have a strong family history of it, but only 5 to 10% of breast cancers are inherited. And in the picture on the left, you see 1 in 8 women will be diagnosed with breast cancer in their lifetime, while 1 in 1,000 men will be diagnosed with breast cancer in their lifetime. So yes, although anyone can get affected by breast cancer, it is very much more common in women. So I'm sure you are I'm sure you are familiar with the stages of breast cancer. You may know that there are 4 stages, but There's actually five: a very early stage, the very, very beginning, zero stage. Abnormal cells are present but have not spread to nearby tissue. So that is the very, very beginning stage before stage 1. Then we go up to stage 1, or early stage. Cancer has spread to other tissue in a small area. So that is stage 1. Stage 2, or localized, a tumor is between 20 to 50 millimeters and some lymph nodes are involved, or a tumor is larger than 50 millimeters with no lymph nodes involved. So when a tumor starts to become a certain size, or it may have lymph nodes involved, that's when it would be considered stage 2. Stage 3, or regional spread, tumor is larger than 50 millimeters with more lymph nodes involved across a wider region. In some cases, there are no tumor present at all. The cancer may have spread to the skin or the chest wall. So at this point, the tumor may not be present. There may not be a tumor at all, but it could have spread to other areas. And the final stage, stage 4, distant spread, the cancer has spread beyond the breast to other parts of the body. And the final stage, stage 4, can potentially be fatal if not treated correctly. There are many different types of treatment options depending on the severity of the cancer, and I'm going to list a few. In more severe cases, doctors might suggest a mastectomy or the removal of the entire breast or breasts. This surgery occurs if the cancer has spread all throughout the breast or if radiation therapy is no longer an option. A lumpectomy removes cancerous breast tissue from the breast, so not the entire breast, just the tissue and some surrounding tissue. Radiation therapy uses X-rays to destroy cancer cells. Systemic therapies are drugs that can be taken that spread around the whole body and can treat cancer cells. After having major breast surgeries, many women benefit from having additional systemic therapy to help get rid of any extra mutated cells. This also reduces the chances of it coming back. It is not necessary, but many people do feel more comfortable with getting extra therapy, extra help afterwards, just to make sure that it is all gone. Some women who undergo surgery for breast cancer get breast reconstruction surgery or a breast prosthesis to feel more comfortable. It is 100% up to the person who gets the surgery. It is not mandatory. It is only there and available to make the people more comfortable, and it is definitely not needed and not necessary in any way. But you can get breast reconstruction surgery or a breast prosthesis to get that normal chest figure back. So I'm sure many of you recognize this ribbon. This is the pink breast cancer ribbon. It is an international symbol of breast cancer. Wearing the color pink or wearing the ribbon shows support of those who have been diagnosed with breast cancer. And Breast Cancer Awareness Month takes place every October and is an opportunity for breast cancer charities to raise awareness and to raise funds for research into its cause, prevention, diagnosis, treatment, and cure. If you would like any additional information, these are the websites that I've used to make this video possible. If you'd like to go visit them, you can, feel free. Otherwise, I really hope you enjoyed this short informational video, and I hope you were able to learn something from it. Thank you.